Let's talk about a topic that most people don't want to say out loud. You started Ozempic and now you can't go to the bathroom. And it's not just a little bit uncomfortable, it's days, sometimes a week, maybe more. You're bloated, you feel full all the time, even more than the medication was already making you feel full. Your stomach feels like a rock, and you're wondering, is this constipation normal? Is this ever going to stop? Or did I do something wrong? I hear this every single week in my clinic and from you as well in my video comment section. And I want you to know two things right now before I even get started. Number one, you are not alone. Constipation is one of the most common side effects of GLP-1 medications. We are talking about 20 to 30% of people who take them may suffer from constipation. Number two, there are things you can do about it. Real things, things that actually work for constipation. Hi, I'm Dr. Bazgha Khalid, and I'm a board certified internal medicine and obesity medicine specialist. And today, let's talk about constipation on GLP-1 medications. So let me paint you a picture. Normally, your gut is moving constantly. Even right now, there are rhythmic contractions happening all the way along your digestive system. Your stomach, your small intestine, your colon, squeezing food and waste through, moving things along. This process is called peristalsis. It's basically your gut doing a slow, steady, wave-like motion, like a snake digesting a meal. When everything is working normally, that wave keeps things moving at a decent pace. Food in, processed, moved along, and out the other end. The whole journey from mouth to exit takes roughly 24 to 72 hours for most people. Now enter Ozempic or Wegovy or Mounjaro or Zepbound. Whatever GLP-1 medication you're on, these medications do something remarkable for weight loss. They slow down how fast your stomach empties. Doctors call it delayed gastric emptying. You feel full longer, you eat less, the weight comes off. But here's the catch. That slowing effect doesn't just stop at your stomach, it travels down through your whole digestive system. Your whole gut slows down. The wave of contractions gets sluggish, slower, and suddenly things that were moving along just fine are now sitting there, waiting, going nowhere. This is constipation on GLP-1 medications in a nutshell. Your gut pump has been turned down, and in a moment, I'm going to show you exactly why this happens at the level of your gut nerves. Because once you understand it, it clicks. But first, let me be really clear about what we are actually calling constipation here. A lot of people tell me they're constipated when what they mean is I'm going less often than I used to, and that might be totally fine. Here's what doctors mean when we say constipation. Fewer than 3 bowel movements per week, hard, dry, difficult to pass stools, straining, feeling like you haven't fully emptied, bloating or abdominal discomfort that doesn't resolve. If you were going every day before and now you're going every 2 days, but it's comfortable and easy, that might just be your new normal on less food. Less food means less waste out. That's actually just basic math. But if it's been 4, 5, 6 days, you're straining, you feel bloated and uncomfortable, your stomach looks distended, that is a problem I'm talking about today. Also, and I say this because I care, if you have severe abdominal pain, vomiting, or haven't passed anything in more than a week, please contact your doctor or go to the urgent care. That goes beyond what we are managing at home. Okay, so here's the biology in simplified version. Your gut has its own nervous system. Seriously. It's called the enteric nervous system. Some people call it the second brain. It has about 500 million nerve cells and it runs the entire length of our digestive tract. It controls everything. How fast things move, how much digestive fluid gets released, when your muscles contract to push things along, and your gut communicates directly with your brain via a superhighway called the vagus nerve. So your brain and your gut are constantly talking to each other. Now, GLP-1 receptors, these are the things that the medication and your natural GLP-1 hormone attaches to in order to have its effect. These GLP-1 receptors are not just in your brain and pancreas, they're also all along your gut wall. And when Ozempic activates those receptors, it slows gut motility. That's the technical term for how fast your gut moves things along. Your stomach normally empties its contents into your small intestine pretty regularly. Like clockwork, GLP-1 medications slow that down significantly. In clinical studies, semaglutide, that's the active ingredient in Ozempic and Wegovy, was shown to delay gastric emptying by a meaningful amount. In some studies, food that would normally leave the stomach in a couple of hours took significantly longer. That's great for feeling full, but not so great for the downstream effects. And then there's your colon, the last stretch of your digestive tract, where water gets absorbed and waste gets compacted before it leaves. When things are moving slowly through your entire system, your colon has more time to absorb water from your stool. More time means more water absorbed. More water absorbed means harder, drier stools. Harder, drier stools is much harder to pass. So now you've got slow movement and difficult stool. Double whammy. And to make it even more complicated, when you are eating less because of the medication, there's simply less bulk moving through your system. Less fiber, less volume, less natural stimulation for your gut muscles to contract. Slow gut, dry stool, less bulk, that's the perfect storm for constipation. Quick pause and question. Have you noticed constipation on GLP-1 medications and how do you manage it? Okay, let's talk about the things people are getting completely wrong about this. Misconception number one is constipation will just go away on its own. I just have to push through it. Sometimes, but not always. For some people, the constipation is worse in the first few weeks as the body adjusts to the medication, and then it eases up as the dose stabilizes. That does happen. But for a lot of people, especially as the dose increases, the constipation either stays the same or gets worse. And some people end up stopping the medication entirely because nobody told them what to do about the GLP-1 induced constipation. That's a tragedy because the solution usually isn't to stop the medication, it's to manage the side effects properly. Misconception number two is I just need to drink more water. Okay, drinking more water is genuinely helpful. I'm going to tell you that in solution section. But water alone won't fix GLP-1 constipation because the core problem isn't dehydration, it's motility or lack thereof. Your gut movement has slowed down. Water helps with stool consistency, but it doesn't speed up a sluggish gut on its own. You need a more complete strategy that I'll talk about later. Misconception number three is I should just take a laxative. Please be careful with this one. Stimulant laxatives like Senna or Bazgha can provide relief, but they can also cause dependency when used regularly. Your gut starts relying on these medications to move instead of doing on its own. There are much better first-line options, and I'm going to walk you through the hierarchy from gentlest to the strongest so you are not just grabbing whatever is in your pharmacy. Let's talk about the fix. Practical solutions from least to most intense to help fix your GLP-1 induced constipation. I'm going to go from the simple stuff you can do today all the way up to what you might need from your doctor if basics don't cut it. Step number one is water, more than you think. I know I just said water alone isn't enough, but water is still the foundation. And most people on GLP-1 medications are mildly dehydrated without realizing it. Why? Because the medications reduce appetite, and thirst and hunger often travel together. If you're eating less, you might also be drinking less. Target at least 2 liters of water a day, at least 2 liters. More if you're exercising or in a warm climate, and don't count coffee or tea toward that total. Caffeine is mildly diuretic, meaning it pulls water out. A simple hack, keep a 500 ml water bottle on your desk or counter, fill it at least 4 times a day. Step number 2, fiber, the right kind in the right amount. Here's where most people get this wrong. They hear fiber and they grab a big bowl of bran cereal or down a fiber supplement and then wonder why they feel more bloated and uncomfortable than before. There are two types of fiber and they do very different things. Number one is soluble fiber. This dissolves in water and forms a gel. It softens stool and slows digestion in a beneficial way. Think oats, flax seeds, chia seeds, apples, pears, beans. Number two is insoluble fiber. This adds bulk and speeds up transit through the gut. Think vegetables, whole grains, wheat bran. For GLP-1 constipation, you want a good balance of both. But the key is to go slow. Adding too much fiber too fast when you're already constipated can actually make bloating worse. Start with one extra serving of fiber-rich food per day. Increase gradually over a week or two. Let your gut adjust. The general target for adults is about 25 to 35 grams of fiber per day. Most people eating a Western diet get about half of that. So there's room to work with. Step number 3 is movement. Your gut needs your body to move. This one is underrated and I cannot say this enough. Physical movement, even just walking, stimulates peristalsis, that wave motion in your gut that got sluggish on the medication. A 15 to 20 minute walk after a meal is a genuinely one of the most effective tools for GLP-1 constipation. Multiple studies have shown that regular walking improves gut transit time significantly. And the bonus, it also helps with blood sugar management, which matters for most people on GLP-1 medication. So after your next meal, get up, walk around the block, your gut will thank you. Step number 4 is magnesium, the underrated mineral. This is my personal favorite recommendation for GLP-1 medication induced constipation, and it's backed by evidence. Magnesium, specifically magnesium oxide or citrate, it works by drawing water into your intestine. That softens stool and stimulates gentle contractions in the gut wall. It's not a harsh stimulant laxative. It works with your gut rather than forcing it. And magnesium is something many people are already mildly deficient in. So it often has other benefits too. Better sleep, less muscle cramping. A typical starting dose is 400 milligram of magnesium oxide, can be titrated up as tolerated. But please check with your doctor or pharmacist first, especially if you have kidney disease, because magnesium clears through the kidneys. And with chronic kidney disease, you should always discuss this with your doctor first. Step number 5 is osmotic laxatives. This is the option if step 1 to 4 aren't enough. If the lifestyle stuff isn't cutting it, osmotic laxatives are the next step. These work by pulling water into the bowel, gently softening and bulking up the stool. The most commonly used one is called polyethylene glycol, sold over the counter as Miralax in the US or Movicol in the UK. It's tasteless, mixes into liquid, and it's one of the gentlest options available. It's actually the first line recommendation by most gastroenterologists for chronic constipation. It doesn't cause cramping, it doesn't cause dependency, and it's safe to use regularly while you are on GLP-1 medications. Step number 6, talk to your doctor if constipation is not resolved. If you have done all of the above consistently for 2 weeks and you're still struggling with constipation, this is a conversation to have with your doctor. There are prescription options. There may be GLP-1 dose adjustment conversations to have as well. And in some cases, especially if there's significant abdominal pain or the constipation seems to be getting progressively worse with each dose increase, your doctor may want to investigate further. Don't just deal with it on your own. Severe constipation left untreated can lead to complications you really don't want, including bowel obstruction in extreme cases. Quick question for you. Out of those 6 steps, which one are you going to try first, or the ones that are already working for you? Let me know in the comments. And if you've already tried some of these, let me know which one worked and which one did not. GLP-1 medication constipation is not just uncomfortable, it actually affects your results on the medications as well. When you're bloated, you feel more full, even more than the medication is already making you feel. Some people end up eating even less than they should, which drives up muscle loss risk. And gut health is metabolic health. Your microbiome, the trillions of bacteria living in your colon, affect everything from your blood sugar regulation to your immune function to your mood. A sluggish, constipated gut is a stressed gut. And a stressed gut does not do any of those things well. So, managing constipation side effect isn't just about being comfortable, it's about making sure your whole system is working the way it needs to work. So, you get the best possible results from GLP-1 medications. Your gut health is your metabolic health. They are not separate. Ozempic constipation is real. It's common, it's physiological, meaning it makes complete biological sense why it happens. And it is not something you just have to accept and suffer through. Here are your 6-step plan one more time to fix GLP-1 induced constipation. Number 1, water, 2 liters a day minimum. 2, fiber, slowly increase to 25 to 35 grams per day, both soluble and insoluble fiber. Number 3, walk after meals. Even 15 minutes make a huge difference. Number 4, magnesium oxide or citrate as needed. Number 5, Miralax or Movicol if the above isn't working. Number 6, talk to your doctor if it's still not resolving. If this video helped you, please hit the like button and subscribe if you want more straight talking medical content about weight loss and metabolic health. No fluff, no supplements to sell, just the honest stuff. Stay happy, healthy, and well. Bye for now.